I'm very pleased to be here today, to celebrate 125 years of University of Michigan. We have a long relationship with the School of Nursing, both in Thailand and Michigan for more than almost 3 decades. When Dr. Hinshaw was the dean, then turned to be dean pro tempore, and it's a very good relationship with Mahidol University, and I think other university that Michigan have been a good relationship with, Chiang Mai, Suranari, I guess, and Khon Kaen, I guess, and we have a lot of alumni from the School of Nursing Michigan doing a very good work and have a great contribution in Thailand in both teaching and research. So today I'm going to talk about women's health and women's rights, which is a long story of my academic life. I first start. I have privilege to work with School of Public Health, Harvard University, School of Nursing, Pennsylvania, and Lancet. So I'm going to speak based on the paper that we published in Lancet, and I'm part of the meeting that we developed, the paper of women and health, and for sustainable development that we had been meeting in Harvard School of Nursing, Pennsylvania, and London, and then go to Barangzhou for the 4 meetings to develop the paper of women's health for the Lancet. Well, I first start with what and why is women's health and what and why is women's right. We all know that women's health improves when women are empowered and women's rights are promoted. It's intricately linked to reproductive health, has profound effect in children and family and the whole society. Poor women's health is costly for women and the countries. Significant proportion of global burden of disease. We develop women's and health, develop a conceptual framework, and we looking at women's health and care, and we look at the human development culture as part of the framework, and then gender equity, human rights, and social justice, and looking at how economic, social, environment, and demographic transition had been affect on women's and health of the whole people. It's not just only women's health, but women for health of other people as well. Women and health in a changing world, economic transition in globalization. Globalization has increased inequity as well between and within the country. Polarized society by income and economic status. We heard the first speaker talking about, the polarized of Africa country and USA. And USA had been helping a lot of African country help by increasing their provider and everything. That is a polarized, but in a way, it's a positive outcome for the polarized society that people can go helping each other. Accelerate disease migration, like we know HIV, and not just only the infected or communicable disease, but also the non-communicable disease, like we share lifestyle. Thai people before this, they ate rice and then vegetable. Now we have hamburger, we have pizza, and we have everything. So we tend to be, share the transition of health risks with the state, or with the Western country. Adopt of an unhealthy lifestyle and diet. That's what we do in Asia. But we have benefit of learning from Western country in protecting ourselves from communicable disease. Environmental transition. We heard about the tsunami, the global, the weather change, the global change. In tsunami, 70% of the deaths in the tsunami were women. In Indonesia, in Thailand, in Philippines, they are all women. Why? In Asia, women are not outdoor activities. So not many women can swim, but tsunami, even you can swim, you still die. But you know how to help yourself more. And in the Eastern world, you not even know what is a tsunami. At that time, people saw the big wave, and they just thought it's a wave. So people don't escape. That is the effect of global change or climate change, environment transition, and its impact on women. However, in the developed country, the 70% of people who die in the heat stroke in England and in many countries in Europe were women, and they are in developed country. The women were victims of that kind of climate change or environmental transition as well. Social transition. In social transition, people move in the urban more. It has both positive and negative side. Overcrowded in the urban or in the city make women access to the health care. In a way, they can access to the health care, but in some way they cannot access to the health care. However, in positive side, shift of gender norm and inequity happen. It has progress in girls' education can provide direct opportunity to improve women's health because they have more education. At the moment, more women in medical school even, in nursing school of course, and in medical school it's a big move of social transition in many ways. In our population continue to grow, and UN just announced that we are going to have 3.5 billion people live in the city, more than half of the world population. And by 2050, the number will boom to almost 6 billion. So we are not prepared for the facility in the urban or in the city. The urbanized is to engine modernization, economic growth, and develop. Then it's challenge accompany rapid urbanization, like we are going to have more unemployment, violence, slum development, poverty, and lack of access to healthcare. Even they are closer geographically to healthcare, but by migrate from other country or from the rural area, women cannot access to healthcare. Among these issues surrounding global urbanization, women and their health jeopardize most owning in gender inequity, lack of awareness among urban developer and policy maker of the unique needs of urban women and girls throughout their life cycle. Political transition. Women's is a highly politicized field. In lower middle income country have constantly limit women reproductive rights. In some countries, women cannot even decide if they are going to have or stop having the babies. And safe abortion is one political issue. You've got to make people happy, not women happy, by have that kind of regulate for women to access, and also the regulate women to access contraception. Safe abortion in many countries is not happen, it's illegal. So women have to go illegal abortion, and they are not safe. Political transition always have benefit for women. Number of women in decision-making position in international organization is increasing, and women become the leaders of many organizations. So it's changing in a positive way. Demographic transition. reduce fertility, has important potential economic benefit. They said it's better when women have small number of children. However, in the next generation, 10, 20 years, we are not going to have a grown-up adult to taking care of the society because we are all age. Increase in Brazil, in China, in Indonesia, and Vietnam, large country with a fairly low fertility, and so the lower fertility. But however, in 27 countries still have high fertility, and women is still in danger of maternal and child health. Epidemiology transition. We have reduction in infection. However, the non-communicable disease is increasing in some lower middle income country. This transition is leading to a so-called double burning of disease, So this kind of things, even in successful health system, however, successful health system reform in many countries that start to have universal coverage, such as Brazil, China, Mexico, and Thailand. We are very successful in making people access to healthcare because of the universal coverage program in this decade. So health has been recognized as central to international development for more than 20 years, either universally or throughout a focus on specific population subgroup of poor, of women and children. So the condition of maternal health and child is getting better. Women's health is a combination of, why women's health? Many people said, why women's health? Because men's health is in a bad shape too, right? Yeah. So we said it's women's health because when men's health, when the illness affect men, it's affect because of the illness issue. But when it's affect women, it's affect their biology, both, and as strongly affect on gender, ideology, and politics. They play politics by using women's reproductive or women's health as well. MDG 4, MDG 5, MDG 6 had been working very well. A maternal death, the ratio of maternal death is lower down. The infant mortality is lower down. Most of the people in the world changing into a better shape. But however, some part of the world still in the bad shape, like the keynote speaker just said so. When we have reduction in child under 5, mortality is reduction. Under 5 die less. Neonatal mortality have been falling. Proportion of children covered by 1 dose of measles vaccine increased from 22% to 80%. Is not, I think it still need to have a better work in that area. Reduction of maternal, we have reduction of maternal mortality as well. So, however, birth to adolescent girl has declined. 80 to 50 births per 1,000 girls in South Asia, but still 117 births per 1,000 girls in Sub-Saharan Africa still. Unmet need of the family planning decline. Right now in Thailand, it's a shame we have unwanted pregnancy for the teenage. We are the top of Asia in that problem, But overall number of the world is getting better. Reduction of maternal, like I mentioned. Yeah, if we see the milestone of women's health we start milestone from 1911, the first International Women's Day Health in Australia, Germany, Denmark, and Switzerland. and we celebrate and we make a turning point for women's health and women's life every decade. Until 1011, WHO add misoprostol to its list of the essential medicine for women's and health. We have 2012, we have first International Day for Girl Child. We start to think that, just Women's Day is not enough. We have to have Girl Child Day as well. UN High-Level Panel on Post 2015 Developed Agenda released a new global partnership, eradicate poverty and transform economics through sustainable development, and women's health is the main thing. Women's right. What is women's right? I just elaborate the health. The bodily integrity and autonomy, to be free from sexual violence, to vote, to hold public office, to enter into legal contract, to have equal right to family role, to work, to fair wage and equal pay, to have reproductive right, to own property, and to educate. This is all women's right. We have to look if in our country we already have all this right for women. The rights for girls, the rights of women and girls. We thought that if girls and women have rights, the burden of disease, the burden of illness will going down. Disease burden of HIV happen because girls cannot protect themselves. When boys or men want to have sexuality with girls, they have choice to wear condom or not to wear condom, not the girl's choice. The right of women and girls emerging HIV and AIDS is obvious that most of the victims are women. 60% of people who live with HIV and AIDS in sub-Saharan Africa and Caribbean are women. Increased death and disability cause NCD. At the moment we shift into NCD. Even HIV shift into NCD because of the antiviral. HIV shift to be the NCD. And the other NCD because of health risks, health behavior risks that is increasing. Killing estimate of 7,000 women that year in 1990 to 1910. Inequity and social determinant of women's health. Inequity exists, girl and women access to health care for their competitive need across their life course. This is inequity, that's what they said, because women and girls need more attention, comprehensive attention, but they didn't access to that. Coverage in antenatal care is seen to be coverage, but most women, because of their obligation, their duty to the family, they cannot access to neonatal when they want to. Poor technical and interpersonal quality of care for all women has been highlighted as a frequent problem in the research. Inequity for another inequity is culture and religion norm. In many countries, if you have male provider, they cannot touch the providees. For example, just giving an example of vaccination. If the person who gives vaccination is a male, women cannot just open their arms, for that vaccinate. So this is impede women from have vaccination. To reduce inequity, the context of universal social protection and health coverage is the key. Although reproductive health, maternal and child health need to be prioritized in the post-2015 era, attention in the large burden of non-communicable disease have to pay more attention because non-communicable disease kill lots of women. High-level meeting on non-communicable disease in 2011 provide excellent roadmap accepted by World Health Organization member state, that 25% reduction in premature NCD mortality rate by 2025. So at the moment, we are working on decreasing pre-disease. So this is a cause of death, a cause of disability. Impact of health on development. We thought that if women's health is in jeopardy, we are going to have productivity loss, burden of disease, reduction of life expectancy, allocation of financial resources to prevent and control of disease, traveler health and tourism, as SAR happen when health and its impact on health and development. Health is a major investment, and women is the main contributors. We all know that doctors, nurses, pharmacists, and other healthcare workers are female, and they have contributed, even they have less income, but they still contribute. In the family with non-pay and pay, women still keep continuously be the contributor of that healthcare. Well, in some countries, it's a good example, just like in Nordic countries, Denmark, Finland, Iceland, Norway, and Sweden have a highest employment rate for women among European countries. So in this case, Norway has one of the highest labor participation rate of women in the world. 77% of women were employed, and Norway has pioneered and implemented a set policy, emphasized three major areas: subsidizing childcare, share parenthood, and women in position of leadership. So this is a big progress in Norway that we have to learn from. So they said to encourage women's higher education, to improve division of family care responsibility, and enable mother to balance work and home life more effectively, and to promote and empower women. Health system is one part that strongly rely on women in the healthcare workforce to function effectively worldwide, as nurses, midwife, doctor, and community health worker are women and are in the front line of institution healthcare. Nurse comprise about 80%. So we are very important healthcare worker, to try to do the global health workforce. This is a strategy that we need to empower nurses to improve the patient care in developed countries. Like this is just an example in Thailand that we improve non-NCD by giving nurses just only 4 months training so they can reduce and catch up with all the NCD and try to do the less severity of diabetes, hypertension, stroke. So only 4 months training, but we still have difficulty in try to train the nurses, because they said only 4 years is more than enough. So nurses have to do all the job without training after they graduate. So they said the strategy that you have to value women and the provider that are female to make them happy with the job, compensate women, estimate value and pay and unpay. So we have to recognize women that work with pay and unpay. Count women and be accountable to women. That is a strategy, and the system will be strengthening. System will be strengthening by women and all the female healthcare provider, policy and practice, make education and training for and career development for these or female healthcare workers that have be the main contributor to the healthcare. Thank you very much. Thank you.